and I'm a lawyer, and I live in Brisbane, Australia. My father, Alan Douglas Gunn, contracted stomach cancer when he was 91 years old, and he was looking at options and treatment, and the best treatment we found that would assist him was the treatment with bicarbonate of soda offered by the Italian oncologist, Dr. Tullio Simoncini. I contacted Dr. Simoncini and I sent him my father's medical records. And Dr. Simoncini examined that and wrote back and said, look, you don't have to come to my clinic for this because the protocol which I outlined for treatment of stomach cancer with bicarbonate of soda on my website, I believe that will work and assist. So we bought the bicarbonate of soda with no aluminum in it and followed Dr. Simoncini's his treatment as outlined on his website, and I gave to my father twice a day a 300 milliliter glass of water with a teaspoon of bicarbonate of soda in it. My father then would lie on his stomach 15 minutes, left side 15 minutes, right side 15 minutes, and on his back for 15 minutes. He did that 7 days a week for approximately 18 months. At the 18-month point, he had a specialist because he had some kidney problems. A specialist sent him for another PET scan, a PET scan. When the PET scan came back to the specialist, it showed no signs whatsoever of stomach cancer, and the cancer had gone. And the specialist doctor was very surprised by this, and he phoned my father's family doctor, a general practitioner. And the general practitioner said, oh, what happened? Oh, you should speak to his son, meaning speak to me. The specialist phoned me and I told him we'd followed Dr. Tullio Simoncini's protocol with bicarb of soda. And in 18 months, my father went from stomach cancer to no stomach cancer whatsoever, all gone. We can't thank, my father has passed on 2 years later from kidney problems and dementia, but we can't thank Dr. Simoncini enough for helping him to eliminate stomach cancer. I fully support Dr. Simoncini and his works.
What did the conventional oncology propose to your father?
The conventional oncology said, whilst there was a possibility that they could use chemo and radium, that they thought because of his age, at this time he's 91, they thought that this might be too much stress on his system. I had also talked to him and just said to him, look, the chemo and radium statistically has a 90% failure rate. All this will do is just accelerate your demise. So he was not going to go down that path anyhow. They didn't offer invasive surgery because they said to him, look, again, because of your age, if we give you a general anesthetic, you may not survive that. And again, I'd said to him, look, we'll try Dr. Simoncini's approach. He's got great success, and this is one we can treat here. My father, after I explained Dr. Simoncini's protocol to him, he was still able to fly at that time and had money. And I said, look, he said, if necessary, we'll go to Italy and go to Dr. Simoncini and get treated by him there. My father said, yes, I'd much rather do that because he'd read the materials and he could see the benefit in it. But anyhow, thank you. We were able to fix him up here in Australia, and he's a success story for Dr. Simoncini's oncology protocols.
Okay, so how long it takes since he started the treatment?
It stabilized at about the point of 6 months because my father once every fortnight was going to a naturopath doctor who was doing blood readings and scans on him, and that's how we were monitoring the cancer like that. That it was the signals being broadcast back for cancer positive from the stomach were getting less and less. And then the thing that was conclusive was when he went for the PET scan and it came back as stomach cancer 0, and that was something that the specialist could not ignore.
Okay. So why you do this interview?
I'm doing this testimonial. My father passed away in April 2021 just from just dementia, and and heart problems. He's almost 94. He was getting to be an old man. But I'm doing this because Dr. Simoncini's protocol does work. In our case, it's a clear example. It greatly assisted and helped my father. He didn't have to go through extra trauma with stomach cancer and all other sorts of things that conventional treatment would have, oncology would have brought that. And that's why we chose that one, and he was incredibly grateful for that. And if he was with us today, he would be doing this testimonial.